Let me show you how I beautify patients with cautious dermal filler. I mark out the facial thirds. This is important both in the horizontal as well as the vertical plane. I then also mark out my beautification point as well as any areas where I see any shadowing and depression, as well as the angle of the mandible is extremely important. I also look at Rickett's line. Here you can see I'm marking out the beautification point as well as my Eiffel Tower treatment for the sides of the mouth to give a little bit more lift and more of a horizontal finish. I'm marking out areas where I'm going to do boluses of filler, but also where I'm going to fan with the cannula. As you can see in the angle of the mandible and the jawline, it's really round to the side of the face. Injection or bolus injections with a firmer dermal filler to give that projection as well as lift deep down on bone is required in younger patients because there's more soft tissue. This is what's going to help suspend the face over time. I then inject more superficially as I get to the corners of the mouth. Here you can see I'm using a 25 gauge cannula, fanning from deep to superficial to support the corners of the mouth. There's no point treating the lips if you're not going to treat around this area. Then I'm using my signature lip treatment, which is multiple linear threads in a retrograde fashion, very superficially to provide hydration as well as a little bit of improvement in height of the lip. I'm now injecting to balance the muscular imbalance as well as the bottom lip, which is always really important to get that nice finish and ratio, and then injected for projection of the chin as well as ensuring that the OG curve is correct, the curvature of the cheeks. And as you can see, she's really happy with the results, which are nice and subtle and gives her a nice fresher look.